Hello friends, this is Dr. Ashish Taneja. Today we are going to discuss the role of 3D printing in orthopedics. It is one of the recent advances in orthopedics. It's quite an interesting research that has come into orthopedics and has made a lot of things possible. So 3D printing, it was in the beginning it was used to make stuff like toys, maybe a pizza, and at this point of time it has come to that far that we are making very high-tech prosthetics like these and custom implants like these to even such fancy cars. So I would say 3D printing is something with which you can make anything and everything you wish to. All you need is to feed in the right data into the machine and give it the right raw material. It can manufacture anything you wish on earth. So what is the concept of 3D printing? It converts a 3D image into a physical model. Like in the previous slides I have shown, if you want to make a toy, you just give the machine the right data and the right raw material, it will make one. You can go on to make even a pizza by giving just the raw materials and the right data into the machine. Even such a high-tech, so intricate prosthesis can be made by just giving the right data to the machine. So going further, it's also known as rapid prototyping or additive manufacturing. The word additive holds a great value because in this procedure, the physical model is made by addition of layer by layer of raw material depending on the data given by your CT or MRI images in DICOM format. So important is that it is additive manufacturing, and what we need is a DICOM format data. These two are very important things to know. And then you can use any raw material. It can be plastics, it can be polymers, it can be glass, ceramic, metals, and even biological materials. This is the recent advance in 3D printing, what we call as bioprinting. I'll go on into details of bioprinting in the end. So let's understand the process. As I said again, previously, it is an additive or a layered manufacturing where this printer will put raw material layer by layer and form a 3D model. So first process is image acquisition. You get a CT or MRI done for your patient. Second, you send these images to the person who has a 3D printer. So they process those images, make a DICOM files of these images, convert them to STL files. So this is a process done by the engineers. Then they do pre-operative planning and editing on their software. And finally, what they give us is a 3D model, which is to be used by us. It has applications in different regions or different specialties of orthopedics, starting from arthroplasty, oncology, complex trauma, osteotomy and deformity correction, scoliosis, and meniscal transplant. These are a few areas where it has been used till now. Complex arthroplasty. So imagine in this patient, if we were to do a TKR, a standard routine TKR, it would have been very difficult because we use intramedullary jigs which have to go into this sclerotic and mal-reduced femur, which would be erroneous in terms of the alignment. Also, in the first place, it will be difficult to pass an intramedullary device into this bone. So for this, these patient-specific instrumentations have been designed, which are very accurate jigs which can be placed on distal aspect of femur like this and proximal tibia, and finally the cuts can be taken without using any intramedullary jigs. So this is one application of 3D printing in arthroplasty. Going further, in arthroplasty, even after so much of advances in techniques and in implants, still 20% of total knee replacement patients are not satisfied. So why? The answer is why. The question is why. So there are some thoughts that if we can manufacture implants as per the patient's size and his specification, we can actually decrease this dissatisfaction rate. So considering that thought, this patient-specific implants have been designed. They can be a total knee replacement, patient-specific implant, unicompartmental knee replacement, or a bicompartmental knee replacement. So this is a I-total CR, which is a cruciate retaining total knee replacement made by 3D printing, a patient-specific implant, or I-uni, a unicondylar knee replacement, which is patient-specific, which has been manufactured based on the specifications of the patient, including the size and the geometry of the distal femur. Even we can design bicompartmental knee replacement. Like in this case, we have used a patellofemoral and a single compartment or maybe medial compartment knee replacement. So this is how we can design implants as per the patient specifications and expect to have better results. There are studies available in the literature where surgeons have used patient-specific instruments and implants and have shown reasonable results. But we still have to have more literature and more evidence to go on to use it on a regular basis. There's one more application of 3D printing in arthroplasty in cases of hip resurfacing. In hip resurfacing, the only problem that we face is the position of the femoral component and the sizing. And if we err in the sizing and position of the femoral component, we can notch the femoral neck right here. That can lead to early failure in terms of neck fracture or late failure in terms of loosening of the component. So to decrease these complications, 3D printing can come to rescue, in which, based on the images given by CT and MRI, we can actually form a jig, have an understanding of the actual patient's femoral head size, and get a jig made like this, through which we can actually pass the intramedullary guide wire or the guide wire passing through the neck in the right position. Once this guide wire is positioned, rest of the procedure will be very accurate, and the risk of neck fracture, notching of the neck, and loosening of femoral component will be reduced. So this is an intra-op picture showing the same. A jig which was made by 3D printing can be applied on the femoral head, and a guide wire can be placed into the head, into the femoral neck in the right direction. So this is one advantage and application of 3D printing in arthroplasty. There was a study done in which this custom made guide wire positioning device was used for hip surface replacement arthroplasty, and it was very accurate to the tune of about 2.9 degree of maximum angular deviation and maximum deviation of distance from normal or from ideal to about 2.1 millimeters. So that is pretty accurate in terms of positioning of guide wire and the results. Going further, we can even use 3D printing to make custom stabler cages in cases with severe bone defects in revision total hip replacements. So if you see this X-ray, and if we have to take this patient for a revision arthroplasty, this sort of a defect is something that we are looking into. We'll probably be facing such a big bone defect to reconstruct if we go in for surgery. So if we can plan how to reconstruct this defect before surgery, that will make surgery much easier. So these models will help us plan our reconstruction We can even make a custom implant like this, which can be just used and can be easily fixed during the surgery, making the surgery much more easier and even reducing the OR time and the blood loss. So these were the applications of 3D printing in arthroplasty. Going further, we should see some application of 3D printing in oncology and limb salvage. 3D printing have been used to make templates for resection of osteosarcoma. This has made the resection more accurate and easier as well. Let's see a case. So this is a case of osteosarcoma of distal femur. So see this lytic lesion right here. Once we evaluate this lesion through CT and MRI, we can actually use those images and send them to our engineers and get a 3D printed model for the same. They can even help us form these jigs through which we can even use these slots for resection. They will actually place these slots at the exact point of resection that we wish to. Also, these models can help us pre-manufacture an allograft to fill in the defect during reconstruction. I'll show you the intra-op examples as well. So this is what sort of models that are made. This is a jig for resection with 2 slots, and this is a model which can be used for making an allograft as per our requirement. So using the same jig application on the real life or real patient, we can have adequate resection which is more accurate. Then we can use the allograft which was fashioned based on the models that were made earlier right here, and then we can fix this allograft into the defect. So see the kind of clinical result we can achieve using 3D printing. This makes the surgery easier and helps us achieve this result much more easily. This is the post-op X-ray of the same patient. This was the lesion right here. This was resected using the jig made from 3D printing, and this allograft was fashioned using the 3D printed model. This allograft was then fixed using a nail. So it's a very well done procedure, and see the kind of results we are able to achieve using this model. And also, not just the ease of surgery, it reduces the blood loss as well. Blood loss and the OR time both are reduced using these models. So the idea is you should prepare difficult surgeries before going in the OT. You should actually be ready, and you should have rehearsed the surgery 2 or 3 times before you actually go in to do the main procedure. Another interesting case. So in this case, the patient has a lesion in the acetabulum, which is difficult to resect, but by using 3D printing, the surgery will become much more easy. We will be able to plan by giving this DICOM images. We will be able to make a model of the patient. We will be able to know the exact area of the lesion and the exact area that needs to be resected. Also, using these models, we will be able to make a custom implant for this patient. So this surgery otherwise would have been a nightmare, but by using 3D printing models, the surgery can be made much more easier. So going further, 3D printing can also be used in filling up defects like these. So this is a case of calcaneum tumor which was resected. To fill up this defect, a 3D printed titanium implant was made to replace the removed calcaneum. So just think of the possibilities that can be achieved using 3D printing. So let's go further and discuss other applications. So one of the main applications where 3D printed models are being used presently in India is in complex trauma, especially in pelvistabular trauma. So just see, such a complex pelvistabular fracture, if we have to fix it without planning, it will be a nightmare. We will be struggling for hours and hours together with lots of blood loss, and to fix it like this, it will be a job of 3 to 4 hours. But if we can have models like these made earlier, before surgery, we get these models in our hand and we are able to plan the surgery before going in the OR. If we are able to plan the exact way of reduction that we want to do, exact implants that we want to use, exact position of implants where we want to place these implants, the surgery will become much more easier. Another clinical case. So this particular case was managed by 3D printing models. So the CT was done, CT was then sent to the engineers, and these 3D models were received. So we practiced our surgery beforehand and practiced the exact methods of reduction, exact placement of implants, how many implants and where, and they have to be positioned. So these all were planned before. So once the whole plan was laid, the plan was executed, and this was the result. So this looks a much better result, and it was achieved much easier as compared to the routine surgery. So 3D printed models really help us in complex surgeries like these. So further on, in scoliosis also 3D printing can be used, in which these models help us in accurate placement of pedicle screws. Further on, in osteotomy and deformity correction, these 3D printed models can be used, and they help us in actually doing the osteotomy accurately. We first get the CT done, we decide the exact place and the exact angle of osteotomy which has to be done, and the plate where in terms of the length of the plate that we need to put in. Once this information is given, 3D printed jigs are made through which the osteotomy is done, and also through which the plate can be fixed by just fixing this 3D printed jig on top of the plate. So this makes such a difficult osteotomy procedure quite an easy one. So the things don't end here. There's so many more applications that you can think of where 3D printing can be useful. People have used 3D printing for making low-cost three-dimensional prostheses for children. So just imagine this patient was fitted with total upper limb prosthesis, and this had a very good function in terms of shoulder function, in terms of flexion extension, rotations, elbow function, in finger and hand movements. The rotations and the movements are pretty, I will say, fantastic. And to top on that, just see the cost that was involved. So this all prosthesis, the raw material cost was $200. So if this technology can be used in making of prosthesis, the quality of prosthesis, the ease of making prosthesis and will become much better, and the cost will come down tremendously. So this is one of the another fascinating application of 3D printing that is still under research, and it will soon be normal practice. So let us list the advantages of 3D printing in orthopedics. It helps in better planning of our surgeries. It is very helpful for education and training of our residents. by using 3D models, we can actually educate them and discuss the surgical plans, surgical procedures that we intend to do, especially in cases of complex pelvic trauma surgeries. This can be done, and this can be used for training of our residents. This makes the surgery much more efficient. This decreases the OR time and decreases blood loss, which is very good for surgical results. And once your plan is accurate and you can execute your plan accurately, the results are automatically going to be improved. What are the limitations? The limitations are cost and the time taken to get these 3D printed models. But with the advancement in technology, both the cost involved and the time they take to get us the models in hand is reducing. So we can use it selectively in our practice, especially for complex cases. So this is the present scenario. But what's the future? The future is bioprinting, where we can actually manufacture bone, cartilage, osteochondral grafts, meniscal grafts using 3D printing like these. These osteochondral grafts can be used to fill up the osteochondral defects right here. We can also make meniscal grafts which can be used for implantation in cases of complex meniscal tears. Some more amazing stuff, the bioprinting, we can make biodegradable tracheal splints. People have even thought of making PEEK skull caps which can be used to fill up the bone defects after craniotomy. The next level, surgeons are thinking of making bioprinted ear, finger, nose, or even organs like kidney and liver. So if that thing comes into routine practice, think about what will happen with organ transplantation and organ donation. It won't be needed at all. So this is the way to go. This is the next level. So all in all, it's a very interesting and helpful technology that can have multiple applications in our practice, and it's good to be abreast with this technology because it will be a very useful tool in our practice soon. So I would say think outside the box. It always helps. Thank you for listening.